Hello guys, welcome back to the Unacademy NEET PG live channel. I am Dr Himanshu Gupta and I have done my MBBS and MD from Maulana Azad Medical College, and I'm an educator at Unacademy. Right. So guys, today in this short lecture of around 1.5 hours, we are going to discuss few important images from the section of MSK Radiology. Right. We are going to discuss few images from the section of metabolic disorders like your scurvy, rickets. Okay. Then we are going to discuss few important images from the section of skeletal dysplasia, skeletal dysplasias like your achondroplasia, like your achondroplasia, Hurler syndrome, Hurler syndrome. Okay. Then I am going to discuss about the ALTA protocol in bone tumors, ALTA protocol in bone tumors. ठीक है. So before I begin. Okay. So guys, here is this NEET PG free test calendar. So here you can find educator curated test that is going to take place at 7 p.m. Then we have this image based question test series that you can attempt at 10 p.m. Right. You can use the code Himanshu Mamsi to attempt this test. You can use the code Himanshu Mamsi to attempt this test and to unlock these free tests. Right. So guys, we have this all India mock test for NEET PG 2022 that is coming up tomorrow at 9 a.m. So you can always attempt this test to know your all India rank, where you stand in your preparation, and you can focus on the weak topics. Okay. So you have to analyze, okay, which are the weak subjects you are not performing well. Pick up the bottom 3 weak subjects. Pick up the bottom 3. Excuse me. You can pick up the bottom 3 weak subjects, and you can start working on them. So how you can work upon it. Okay. So guys, you can go for the 1 month subscription of the Unacademy. Okay. So in this 1 month subscription, guys, we are coming up with this batch on frequently forgotten volatile topics and emergency medicine. You can join this batch, and we have another MCQ batch that is coming for you guys. Okay. You can go for this NEET PG batch. You can just listen to the classes of your subjects in which you are not performing well. We have this MCQ revision batch that has started on 27th April. Okay. And you can you can focus on the subjects that you are not performing well, and listening to the video classes, listening to the live lectures will definitely help improve your concepts, and there is this offer that is valid till 30th April, where you can get a 20% discount also if you use my code. Right. So guys, now guys, this is the Unacademy Lite for NEET PG. Okay, so here you are going to find the test series for various subjects, full length mock test, and previous year question papers. Okay, so we have this plus subscription also, in which you can apply for various batch courses. If you are preparing for in final year, okay, then we have a batch going for the final year students. If you are intern, okay, we have a batch going for you as well. And if you are preparing for NEET PG 2022, okay, we have a MCQ revision batch that is going on. Right. And in this iconic subscription, guys, you are going to find the best of Unacademy as well as Prep Ladder. Okay. So guys, now we can start with the images. start with the images from the section of musculoskeletal radiology. From the section of musculoskeletal radiology. Okay. So how many of you guys are here? Just say hi to me if my voice is clear to you. Okay. How many of you guys are listening? So guys, beginning with the first X-ray, guys. What are you able to see on this image? What are you able to see? This is an X-ray of the hand. What are you able to see on this X-ray of the hand? What are you able to see on this X-ray of the hand? Anyone, guys? Hi Arvind Gopal. What are we able to see on this X-ray of the hand? So guys, if you look at this X-ray very carefully and you look at the radius, you can see that the radius is showing widening, cupping and fraying of the metaphysis These are the features that you are able to see on this X-ray of the hand. These are the features that you are able to see on the X-ray of the hand. Okay, so this is not a case of Down syndrome. This is a case of anyone in the comment section who would like to answer what is being shown here. What is being shown here? Anyone who would like to answer what is being shown in this image? X-ray of the hand. So guys, this image is showing a case of rickets, where you are going to find widening, cupping and fraying of the metaphysis. Okay. So again, another image in which we are being shown a subperiosteal hemorrhage. Okay, tremor field zone of rarefaction. Is being shown. Okay, dense zone of provisional calcification is shown. Is shown. Okay, and radio density is seen around the epiphysis, which is known as Wimberger ring sign, and a Pelton spur. Okay, so guys, all these are important characteristics of which metabolic bone disorder. Anyone? All these are characteristics features of which metabolic bone disorder? Anyone, guys? Anyone? All these are characteristics features of which metabolic bone disorder? So guys, these are characteristic features seen in a patient with rickets. Right. So now guys, moving on to the next image. So guys, in this image we can see that the costochondral junction, okay, it is widened. Okay, and this widening of the costochondral junction, guys, it is known as rachitic rosary. So this is again an important feature seen in patients with rickets. Okay, so just hold on with me for a second. Okay, just hold on. Yes. So now guys, moving on to the next X-ray. Guys. Okay. So guys, what do we see on this X-ray? Anyone? What are we able to see on this X-ray? So if you look at the X-ray of the hand, if you look at the phalanges, okay, you will see that there is resorption seen on the radial aspect of the middle phalanges. Okay, there is subperiosteal resorption seen on the radial aspect of the middle phalanges. Subperiosteal resorption is seen on the radial aspect of the medial phalanges, right? Middle phalanges. If you look at the skull, you are seeing that there are tiny radiolucencies seen within the skull, which is giving this salt and pepper appearance. Okay, and if you look at the vertebra, so these vertebra are giving a rugger jersey spine appearance. Okay, so guys, all these features you are going to see in a case with hyperparathyroidism. Okay, and sometimes this subperiosteal resorption will be so much, okay, that you are going to see a radiolucent lesion within the metacarpals. Okay, so this radiolucent lesion within the metacarpals, this is known as your brown tumor. Right? This is known as your brown tumor. Okay. Now guys, moving on to the next image. So hyperparathyroidism, we all know it is associated with men 1, and men 2A. Can you tell me what are the other features you are going to find in men 1 syndrome? What are the other features you are going to find on men 1 syndrome? Anyone? Other features that you are going to see on the men 1 syndrome? Other features that you are going to see in the men 1 syndrome. Men 1. So 3 P's are seen in the men 1 syndrome. Can you tell me what are the 3 P's? Seen in the men 1 syndrome? 3 P's seen in the men 1 syndrome. The 3 P's include your prolactinoma. Okay. Then you have hyperparathyroidism, and you have pancreatic tumors. These are the 3 P's you are going to find in men 1 syndrome. Right? So coming on to the next X-ray, guys. What are we able to see on this X-ray? Of the hand? Anyone? Where is this arrow pointing towards? Anyone, guys? What are we able to see on this X-ray of this hand? And where is this arrow pointing towards? Anyone, guys? Can you find out what is the abnormality here? So here in this X-ray of the hand, we can see that there is increase in the density. Of the lunate bone. Is seen. And this increase in the density of the lunate bone, it is seen in a case with osteochondritis. osteochondritis of lunate bone. It is seen in a case with osteochondritis of lunate bone. And guys, this osteochondritis of lunate bone, osteochondritis of lunate bone is known as osteochondritis of lunate bone is known as osteochondritis of lunate bone is known as anyone, guys, anyone in the comment section. Osteochondritis of lunate bone. Come on, guys, simple question. It is known as your Kienbock disease. Kienbock disease. Kienbock disease, right? So in osteochondritis, guys, what is the abnormality you are going to find? You are going to find increase in the density of the bone, increase in the density of the bone that you are seeing here, okay. So can you help me name other osteochondritis as well? Can you help me name other osteochondritis as well? Osteochondritis of calcaneum is known as anyone in the comment section. Osteochondritis of calcaneum is known as it is known as Sever's disease, right? Osteochondritis of the thoracic vertebra, it is known as osteochondritis of thoracic vertebra, Shorman disease. ठीक है? Is that right? Tubarias is known as Shorman's disease, right? Osgood-Schindler's disease. ठीक है? Osteochondritis of the tibial tuberosity is known as Osgood-Schindler's disease. ठीक है? Now, guys, what are we able to see? This is a patient who had history of blood transfusions. What are we able to see on this X-ray of the skull? On this X-ray of the skull, we are able to see this hair on end appearance. On this X-ray of the skull, we are able to see this hair on end appearance. And this hair on end appearance, guys, it is seen in thalassemia patients. Hair on end appearance, it is seen in very good to Barias. It is seen in thalassemia patients. बहुत ही अच्छे. Now, guys, moving on to the next image. Guys. What are you able to see on this image? What are you able to see on this image? Anyone, guys? What are we able to see on this image? Voice is not clear. Is voice not fine? Let me just check. Voice is not clear. So I think the voice is fine. It is fine. You can use your headphones if the voice is not clear. Okay. So, guys, on this image, we can see that your there is widening of the bone. And this widening of the bone is giving this flask-shaped appearance. And this flask-shaped appearance is known as your Erlenmeyer flask deformity. This is known as your Erlenmeyer flask deformity. Erlenmeyer Flask deformity is seen on this X-ray. So guys, this Erlenmeyer Flask deformity is shown by the following. And the mnemonic is tongs. Okay, where T stands for thalassemia. T stands for thalassemia. O stands for osteopetrosis. So this can also come as a question in your exam. So this Erlenmeyer Flask deformity is seen in thalassemia patients, osteopetrosis, Niemann Pick disease, then G for Gaucher's disease, and S for sickle cell anemia. Okay, so these are the places where you are going to find this Erlenmeyer Flask deformity. Okay. Now this is another NCCT spine image has been shown to you. Coronal images have been shown to you. What is the characteristic appearance that you can see in the vertebra? Anyone? What is the vertebral appearance that you are able to see in these images? Vertebral characteristic image of the vertebra. So this patient had history of veno-occlusive crisis like your acute chest syndrome. So what is your diagnosis? For this case, guys? So here on these NCCT spine images, guys, we can see that these vertebra have an H-shaped appearance. The vertebra, they have an H-shaped appearance. So anyone in the comment section who can tell me these H-shaped vertebra, these are seen in which cases? H-shaped vertebra are seen in which cases? H-shaped vertebra are seen in cases of sickle cell anemia. H-shaped vertebra are seen in cases of sickle cell anemia. Right? So guys, moving on to the next X-ray. So in the next X-ray, guys, we can see that there is a uniform decrease in the density of the bones. Uniform decrease in the density of the bones. And these vertebra are giving this fish mouth. Okay, if you look at the appearance of the vertebra, they are giving this fish mouth appearance of the vertebra can be seen. Fish mouth appearance of the vertebra. Can be seen. So guys, this fish mouth appearance of the vertebra is seen in which cases? These are seen in cases of osteoporosis. In cases of osteoporosis, you are going to get this fish mouth appearance. In cases of osteoporosis, you are going to get this fish mouth appearance of the vertebra. So guys, till now we have done a fish mouth appearance of the vertebra. We have done H-shaped vertebra. Okay, and we are going to study we have studied the rugged jersey spine. So calcification of IVD, calcification of intervertebral disc is seen in. Calcification of the intervertebral disc is seen in which case? Anyone? Okay, calcification of the intervertebral disc is seen in. Calcification of IVD is seen in. Anyone, guys? Calcification of the intervertebral disc is seen in which case? Calcification of intervertebral disc is seen in which case? Gout, rheumatoid arthritis, psoriasis. Gout, rheumatoid arthritis, psoriasis. Which case you are going to see calcification of the intervertebral disc? Anyone in the comment section? Anyone in the comment section? Calcification of intervertebral disc. Calcification of the intervertebral disc. So guys, calcification of the intervertebral disc, is seen in a patient with homogentisate oxidase deficiency. Homogentisate oxidase deficiency, that is your L-captonuria. L-captonuria. Now guys, moving on to few images from the section of skeletal dysplasias. Okay, very good Abhishek. Few images from the section of skeletal dysplasia. Okay, so guys, what are we able to see? In these images? What are we able to see in these images? What are we able to see in these images? What are we able to see in these images? So guys, this is an X-ray of the limb, X-ray of the lower limb. So we can see that the femur, okay, femur is short in size. Very good, short limbs. Very good, Abhishek Sharma. So this is basically your rhizomalia. Short limbs can be seen. Within the vertebra, we can see that these vertebra are having a bullet nose appearance. Nose appearance of the vertebra can be seen. Bullet nose appearance of the vertebra can be seen. Very good. And in the third case, we can see that the fingers are of equal size. The fingers are short. They are of equal size. Short fingers of equal size with gap between the third and the fourth finger. Right? This is known as your trident hand. So guys, bullet nose vertebra, rhizomalia, trident hand, all these are important features of which disorder? That is your achondroplasia. And if we look at the other images, we are going to find that these patients are also going to have short pedicles. Okay, and this short pedicle is going to result in the compression of the spinal cord. Okay, and these patients are going to have a champagne glass pelvis. Okay, because of the flattened acetabula. So what are the important features? You are going to find in achondroplasia? You are going to find short limbs. You are going to find bullet nose appearance of the vertebra, and you are going to find increase in the gap between the third and the fourth metacarpals. Very good. So Abhishek, try to identify this case. Try to identify this case. If you need any hint, I'm going to show you this second image. Okay, so in this second image, you can see that the patient is able to touch both his shoulders. So take 5 seconds and try to answer this question. What are you able to see in this image? What are you able to see in this image? Anyone, guys, what are you able to see in the comment section? So guys, in this image we can see, if you look at the bones, very carefully, you will see that only the medial end of the clavicle is being visible here. Only the only the only the medial end of clavicle is visible here. Medial end of clavicle is visible here. When only the middle end of the clavicle is visible, and you can see this is your acromion process. So in a normal x-ray of the shoulder, normal x-ray of the chest, you will see that this acromion process, it is going to form a joint. It is going to form a joint with the clavicle. It is going to form a joint with the clavicle, and when this joint is not forming, when this medial end of the clavicle, it is not joining, when this acromion process is not making any joint with the lateral end of the clavicle, this is because the lateral end of the clavicle is absent here. Lateral end of the clavicle is absent here. Okay, so when this lateral end of the clavicle is absent, we are going to call it as which disorder? We are going to call it as cleidocranial dysplasia. We are going to call it as cranial dysplasia, right? So in this cleidocranial dysplasia, guys, what you are going to see, you will see that the patient is able to touch both his shoulders. Can you touch both your shoulders? Can you touch both your shoulders? No, you will not be able to touch both your shoulders. Okay, and if we are going to have a look at the sutures, okay, if we are going to have a look at the sutures, we will see that the patient is also having bones. The patient is also having bones within the sutures. Bones within the sutures can be seen. So guys, these bones within the sutures is again seen in these patients, and this is known as Vermian bones. This is known as Vermian bones. Okay, so Vermian bones are nothing. These are bones within the sutures of the skull. Bones within the sutures of the skull. Okay, so can you tell me one more disorder that you have studied in which you can see Vermian bones? One more disorder in which you are going to see Vermian bones, that I am going to show you as we move ahead. So it is seen in a case with osteogenesis imperfecta. It is seen in a case with osteogenesis imperfecta, right? So guys, other features that you are going to see, that you can see in these patients, is that increase pubic diastasis, increase in the gap between the pubic bones, Okay, so another very interesting X-ray. So in this X-ray, guys, we can see that the mother had history of which drug use? Warfarin use. Okay, and the baby born to this mother, it showed calcification. The baby born to this mother showed stippled calcification in the epiphysis of the long bones. Stippled calcification can be seen in the epiphysis of long bones. Okay, so this stippled calcification in the epiphysis of the long bones can be seen in which patient? Can be seen in which disorder? Anyone? The stippled calcification associated with warfarin use is seen in which disorder? So this is seen in a case with chondroitis Anyone? Chondro chondrodysplasia, chondrodysplasia punctata, chondrodysplasia punctata. Okay, so this appearance, guys, this appearance is also associated with alcohol use. This is also associated with alcohol use. ठीक है, alcohol use in a pregnant female, right? So this is a similar case of chondrodysplasia punctata, in which you are seeing stippled calcification in the vertebra, right? So moving on to the next X-ray, guys. What are we able to see on this X-ray? If you guys look at this X-ray, you will see that the radius, okay, radius is absent in these patients. Okay, the radius is absent in this patient. There is only one bone that you are able to see. Only one bone is seen in the forearm. And that is your ulna. So Teja Kumar, what will be your diagnosis? This is a case of Holt-Oram syndrome. So any congenital heart disease that you can find, any congenital heart disease that you are aware of, that you can find within these patients, any congenital heart disease, that is your ASD, right? So in this patient, we can see that the fingers are long. These long fingers, these are known as your arachnodactyly long fingers. The patient also had history, also presented with aortic dissection. बहुत ही अच्छे अलका दुबे. This is a case of Marfan. This is a case of aortic dissection, long fingers. This is a case of Marfan syndrome. ठीक है. So in this image we can see that the posterior iliac spine, okay, posterior iliac spine of this patient is prominent. Posterior iliac spine is prominent in these patients. Okay, and this posterior iliac spine, guys, this is giving the shape of horn. Okay, so this posterior iliac spine in the form of horns, which are known as iliac horns, this is seen in a disorder that is your nail patella syndrome. Okay, so in these patients you can also find absent patella. You can also find agenesis of the patella as well. Okay. So coming to the next X-ray, guys. What are you able to see on this X-ray? Guys? Anyone? What are we able to see on this X-ray? What are we able to see on this X-ray? So guys, if we look at this X-ray, okay, this X-ray is showing J-shaped cella. This X-ray is showing J-shaped cella, and in the vertebra, we can see that there is inferior beaking of the vertebra can be seen. Inferior inferior beaking of the vertebra can be seen. Inferior beaking of the vertebra can be seen. So guys, this inferior beaking of the vertebra, this is seen in which case? This is seen in which case? Anyone? Hurler syndrome. Hurler syndrome, you are going to see inferior beaking of the vertebra. Inferior beaking of the vertebra, right? So, and also in these patients you are going to find short fingers. Short fingers will be seen in these patients, okay? And in the ribs, you are going to see that the ribs will appear wide. Ribs will appear wide in these patients. Ribs will appear wide in these patients, and this is what is known as spatulated appearance. Spatulated appearance of the vertebra. Spatulated appearance of the vertebra can be seen in these patients. ठीक है? So guys, this is the case of Hurler syndrome, in which you are going to see J-shaped sella, inferior beaking of the vertebra, then spatulated appearance of the ribs, and short fingers. Right? So another X-ray of the spine. This is an X-ray of the spine. X-ray of the spine is shown to you. Then you have the X-ray of the X-ray of the spine. These are showing central beaking. Of the vertebra. X-ray of the spine is showing you central beaking of the vertebra. Central beaking of the vertebra can be seen. Okay. And on the lateral view we can see that the dens is absent. Dens can be seen, and we can see that there is dysplasia of the head of the femur. Can be seen. So guys, just remember, this is seen in a case with Mori-Kuo syndrome. Okay. So right now guys, we have discussed a lot of imaging appearance in the vertebra. We have seen. So let us revise what are the various vertebra we have discussed. So just tell me in the comment section. Rugger jersey spine. Rugger jersey spine is seen in which case? Come on guys. Rugger jersey spine is seen in which case? Rugger jersey spine is seen in which case? It is seen in case with hyperparathyroidism. Then we discussed your inferior beaking of the vertebra. Inferior beaking of the vertebra is seen in anyone? Inferior beaking just discussed. Hurler syndrome. Then we discussed your bullet nose vertebra. Bullet nose vertebra is seen in anyone? Achondroplasia. ठीक है? Then your fish mouth appearance. Fish mouth appearance of the vertebra. Fish mouth appearance. Anyone guys? Fish mouth appearance of the vertebra is seen in osteoplasty. ऑस्टियोपोरोसिस, ठीक है। So moving on to the next images, guys. What are we able to see in these images? So in these images, guys, we can see there is a fracture. Okay, there is decrease in the density of the bones. And there is fracture involving the multiple bones. Bilateral femur here. Okay, fracture involving the multiple bones. Okay, fracture involving the multiple bones. Okay, that is same अलका दुबे, ठीक है। So just look at the fish mouth. This is how your fish mouth will look like, ठीक है। So all these are just similar appearances. Then bilateral fracture involving the bilateral femur, right? And other features that you can see in these patients are blue sclera. Then third is your hearing impairment. Blue sclera, hearing impairment, ठीक है। And we can also see dentinogenesis imperfecta. Okay, dentinogenesis imperfecta. Very good. This is seen in a case with osteogenesis imperfecta, ठीक है। So guys, other features that we are going to see in these patients, will be we will see that your head of the femur will be protruding into the pelvis. And this is known as protrusio acetabuli. Head of the femur is protruding into the pelvis, known as protrusio acetabuli. We can also see that these are your sutures, and within these sutures we can find the presence of Vermian bones. ठीक है। So guys, blue sclera, protrusio acetabuli, multiple fractures, hearing impairment, dentinogenesis imperfecta, all these are very important features of the disorder that is known as your osteogenesis imperfecta. ठीक है। So let us see another disorder where you see there is diffuse increase in the density of the bones. Okay, so there is increase in the density of the clavicle, your scapula, your humerus, right, and your ribs. Diffuse increase in the density of the bones can be seen. So this is seen in a case with osteopeterosis. ठीक है। And guys, within the vertebra, within the various bones, okay, you are going to get this appearance that is known as bone within a bone appearance. Bone within a bone appearance can be seen in these patients. And in the vertebra also we are having this bone within a bone appearance. ठीक है, clear? So another sclerotic disorder. What are we able to see in this sclerotic disorder? what are we able to see in this sclerotic disorder? We can see that there are multiple multiple radiodensities, okay, oval shaped radiodensities can be seen around the knee joint, around the hip joint, okay, and this is a characteristic feature. This is a characteristic feature of osteopoikilosis. This is a characteristic feature of osteopoikilosis. ठीक है. So guys, this was all about skeletal dysplasias. ठीक है. Let me just revise it for you. In the first image we saw an X-ray of the achondroplasia, in which there were short bones, bullet nose vertebra, 10 short fingers with gap between the third and the fourth finger. We can find that the pedicles were short in length. Okay, and the pelvis had a champagne glass pelvis appearance. In the second image, we saw that the lateral end of the clavicle was absent. And this is seen in a case with cleidocranial dysplasia. Lateral end of the clavicle is absent. Other features that you are going to see is the presence of the vermian bones. And these vermian bones are bones within the sutures. Are known as vermian bones. Then this patient had history of warfarin use. Okay, and the baby that was born to this mother showed stippled calcification in the epiphysis of the long bones. And this is a disorder of chondrodysplasia punctata. Okay, when X-ray of the spine was also done, we could see that there was stippled calcification seen. Stippled calcification could be seen in the vertebra. Okay, stippled calcification could be seen in the vertebra. In this image, there was absent radial ray syndrome. Okay, can be associated with halt or arm syndrome, in which you are going to find ASD. Marfan syndrome, guys. You can find long fingers. Aortic dissection. Prominent posterior iliac spines giving the shape of iliac horns. So guys, this is a case of what? Anyone? This is a case of nail patella syndrome. Right? Then I showed you J-shaped sella with bullet nose appearance of the vertebra. Okay, J-shaped sella with bullet nose appearance of the vertebra. This is seen in a case with Hurler syndrome. Right? Okay. So guys, just hold on for a second. Okay. So then we other features that were seen in these patients were short fingers and spatulated appearance of the vertebra. Okay, right? Okay. So guys, what was this syndrome? In this syndrome, we could see that there was central beaking of the vertebra. Could be seen. Then we could see that there was absent dens could be seen in these patients. And we could see that the femur, it was dysmorphic, ठीक है, dysmorphic. So now guys, we will begin with few images from the section of arthritis. Okay, from the section of arthritis. ठीक है, beginning with the most common disorder, that is your degenerative joint disease. Degenerative joint disease. ठीक है. So guys, what are the important features? Okay, that you are going to see in a patient with degenerative joint disease. You are going to see that there will be non-uniform loss of joint space. So what do you understand by non-uniform loss of joint space? What do you understand by the non-uniform loss of joint space? Anyone? So guys, what do you understand by non-uniform loss of joint space? So guys, if you look at the knee joint, okay. So in the knee joint, there are two compartments, a medial compartment and a lateral compartment. So in a patient with degenerative joint disease, you will see that the reduction in the joint space, will be more on the medial aspect as compared to the lateral aspect. Reduction in the joint space will be more on the medial aspect as compared to the lateral aspect. Other features that you are going to see in these patients will be that there will be presence of periarticular osteophytes. Periarticular osteophytes can be seen. Okay, in later stages you can see that there is dislocation of the joint, subluxation of the joint can be seen. Joint subluxation can be seen in the latter stages, and you are going to see that there will be increase in the density in the subchondral portion of the bone, right? So this is your degenerative joint disease. And you know, similar features will be seen in the facet joint also. So here in this case you can see that there is subchondral sclerosis and decrease in the joint space between the facet joint. Okay, another important spotter we can say. Can anyone help me? What is this spotter showing? What is this spotter image showing to us? What is this spotter image showing to us? What is this spotter image showing to us? Anyone, guys? So guys, in this image we can see that there is flowing calcification, okay, can be seen along the along the anterior aspect of the vertebra. Flowing calcification can be seen along the anterior aspect of the vertebra. So this flowing baxi calcification along the anterior aspect of the vertebra. Very good happiness zone. This is seen in a patient with dish. And what does dish stands for? What does dish stands for? Dish stands for diffuse idiopathic skeletal diffuse idiopathic skeletal hyperostosis. Diffuse idiopathic skeletal hyperostosis. ठीक है, बहुत ही अच्छे. So similar image guys. What are we able to see in this image? What are we able to see in this image? Anyone? What are we able to see in this image? What are we able to see in this image? What are we able to see in this image? Yes, बहुत ही अच्छे यार. Happiness zone, very good diagnosis, very good diagnosis. So here in this image, very good. There is calcification of the posterior longitudinal ligament, and this is known as ossified posterior longitudinal ligament. This is known as ossified posterior longitudinal ligament. ठीक है. So another X-ray where you can see destruction of the carpal bones. Okay, destruction of the carpal bones can be seen. Okay, we can see dislocation of the joint. We can see debris within the joint. Increase in the density of the joints can be seen. Debris, dislocation. Joints appear disorganized. Okay, joints appear disorganized. So guys, all these 5Ds, these are important features of 5Ds are important features of which arthritis? Okay, these are important features of neuropathic joint or your Charcot joint. Okay, where you are going to see destruction of the joint, dislocation of the joint, formation of debris, increase in the density of the bones, and joints appear disorganized. So very good. So these are seen in patients with leprosy. ठीक है, डायबिटीज mellitus. ठीक है, सेरिंगोमाइलिया. ठीक है, syphilis. Very good. ठीक है, in all these conditions you are going to find these Charcot joint. ठीक है. Another important case guys, another important case. What are you able to see in this case? Anyone? What are you able to see on this case? So guys, in this image we can see this. There is again destruction of the head of the femur can be seen. Okay, destruction of the toes can be seen. So here this is another case. This is your characteristic licked candy stick appearance. That you see in patients, that you again see in patients with neuropathic joints. ठीक है, neuropathic joints. ठीक है, another very interesting spotter. Another very interesting spotter guys. What are you able to see in this spotter? Multiple oval shaped radiolucencies can be seen in the joint space, in the knee joint space. ठीक है. So guys, there is metaplasia of the synovium, and it starts producing these loose bodies. This is a case of synovial synovial osteochondromatosis, synovial osteochondromatosis, synovial osteochondromatosis. ठीक है ना, multiple oval shaped radiolucencies can be seen around the joint. Okay, so now guys, I'm going to discuss with you few imaging features of the rheumatoid arthritis. Rheumatoid arthritis. ठीक है. So guys, what happens? What is the pathology? What is the pathology in the rheumatoid arthritis? Okay. Destruction of the pores can be seen. Here, this is another case. This is your characteristic. Okay. So guys, in this case we can see there is, in a patient with rheumatoid arthritis, what happens, there is hyperplasia of the synovium. Okay, so normally in a normal patient, this is how your synovium is lining the joint cavity. Okay, synovium is only present in the around the joint. ठीक है, it is not lining your articular cartilage. ठीक है. So what happens in these patients? In these patients of rheumatoid arthritis, there is proliferation of this synovium. There is synovial proliferation. So what happens when there is proliferation of the synovium? It enters, okay, it enters the articular cartilage as well, and it causes destruction of the articular cartilage. It causes destruction of the articular cartilage. So when there is destruction of this articular cartilage, is the voice fine now? When there is destruction of the articular cartilage, what happens? You know, there is decrease in the joint space. Okay, there is decrease in the joint space when there is decrease in the joint space when this synovium erodes your articular cartilage. What happens? There is uniform loss of joint space. There is uniform loss of joint space in these patients. Uniform loss of joint space is seen in these patients, right? And one very important feature of rheumatoid arthritis is that you are going to find periarticular erosions. Periarticular erosions will be seen in these patients. Periarticular erosions will be seen in these patients. So there is synovial edema and effusion. How does this present? This presents as periarticular soft tissue swelling. Okay, so cartilage destruction by pannus. How does this present? This presents with uniform loss of joint space. This presents with uniform loss of joint space. ठीक है, this presents with uniform loss of joint space. ठीक है, then pannus eroding in the bare area. This presents as marginal erosion. Right? And what we are also going to see, okay, there is inflammatory hyperemia. Okay, because this is an inflammatory disorder, inflammatory pathology. Okay, there will be increase in the vascularity, and that will result in juxta-articular osteoporosis. So guys, let us see all these features of rheumatoid arthritis on this X-ray of the hand. Features of rheumatoid arthritis. So guys, what are we able to see? We are able to see that there is decrease in the density of the joint around the decrease in the density. Okay, juxta-articular osteoporosis can be seen. Decrease in the density, okay, around the joint, that is your juxta-articular osteoporosis can be seen. Then we can see that there is erosion of the joint. Okay, so this erosion will help you to differentiate it from other disorders like your degenerative joint disease. In degenerative joint disease, you are never going to see any erosion. ठीक है, then guys, you are going to see the presence of subchondral bone cyst can be seen in these patients. ठीक है, So some characteristics deformity, is your botonier deformity. So guys, what is this botonier deformity? In botonier deformity, you are going to see that there will be in botonier deformity, you will see that there is flexion at the proximal interphalangeal joint and extension at the distal interphalangeal joint. Flexion at the proximal interphalangeal joint and extension at the distal interphalangeal joint. And swan neck deformity. What is swan neck deformity? In swan neck deformity, you are going to see that there is extension at the proximal interphalangeal joint and flexion at the distal interphalangeal joint. ठीक है. So guys, this was a case of ankylosing spondylitis. Right? So guys, this was all for today. So we are again going to meet on the Unacademy platform, right? So you can, if you don't have the Unacademy learning app, you can always download it. Right? And before I end this session, let me tell you few important things that are coming up on the platform. So guys, we have this free test series that are going on for the students. So there is one test that you can attempt now at 7 p.m. Okay, and 10 p.m. So this all India mock test, guys, don't forget to go for this all India mock test. So this all India mock test will be there at 9 a.m. tomorrow, okay, on 1st May. So do attempt this mock test. Okay. So do attempt this mock test. Okay. And we are giving there is one offer that is coming up, 20% off till 12 p.m. today. So you can go for this 20% discount and use my code HimanshuMMC, right? So I hope guys you enjoyed this session. Okay, till then guys, bye bye, take care, keep working hard.